And we are ready.
Okay. Welcome to our Healthy Lifestyle Talk. Tonight, we are talking about perinatal services at Northern Inyo Hospital. I am Janine Arndal. I'm one of the OBGYNs. We kind of just want to highlight some of the services that are available and the providers that will be taking care of you or your loved one during the time frame of pregnancy, delivery, and postpartum. Our group does include 3 full-time OBGYNs, myself, Dr. Martha Kim, and Dr. Jeannie Flum. We have a full-time physician assistant, Jenny Figueroa, and full-time certified nurse midwife, Jennifer Norris. We also on the talk tonight have our director of perinatal nursing, Julie Tillemans. So we want to welcome you guys all tonight and thank you for joining us on this beautiful Thursday evening. Our perinatal services are always growing and expanding, and this year, since the beginning of January, we've also been providing delivery services for Mono County as well. So if you or a loved one are pregnant or thinking about becoming pregnant, we hope that this talk is helpful to kind of introduce ourselves and some of our services. The first person who's going to talk tonight is Jenny Figueroa, our physician assistant. She's going to talk about some of the clinical services that we have available.
Hi, everyone. My name's Jenny Figueroa. If you don't know, there are a lot of J's in our practice, so it's really easy to get confused. We have Jeannie, Janine, Jen, Jennifer. And now we have Julie. So last names are often helpful. We offer obviously complete prenatal care, but we also offer a lot of gynecological services in the clinic. So we routinely screen for STDs, offer contraceptive options for both teenage and our adult patients. We also do our annual Well Woman exams. We also provide multiple surgical consults and options for urinary incontinence, menopausal treatments, anything that you can think of for women's health, including postpartum depression or just generalized anxiety and depression, we treat. So feel free to come see us for your annual exams because we can also just offer basic labs, and we can always refer you to see a specialist or your primary care provider where we feel that it's appropriate. As far as prenatal care, we like to see you quite often during your pregnancy. So we generally start seeing everyone at 8 weeks, and that would be your first visit with us. It is called the confirmation visit. So you come in and you get your ultrasound, and we determine how far along you are and then just give you some general overall guidelines and information about our practice. All of our labs are done at the Northern Inyo Hospital lab, which is pretty much just directly across the street in the main hospital. It's pretty convenient, especially for our patients out of town, because we can often coordinate with you getting your labs drawn and our appointments. So you can come in, see us, we can put all the orders in the computer for your labs, and then you can walk right over to the lab and get all your blood drawn. In pregnancy, for those of you who have been pregnant before or who haven't, the first blood draw, there's kind of a decent amount of blood that we draw, so it's nice to do it, in-house and close to the clinic. We do offer a variety of prenatal screening tests, so genetic screening tests. Those are, some are done in-house and then we do send them out. So testing for any chromosomal abnormalities or to see if you're a cystic fibrosis carrier or for some other genetic diseases. If we were to need any higher level of care in our service, we would refer you to see a maternal fetal medicine specialist. We do have lots of contacts with Reno. There's a high-risk pregnancy group there, as well as many down south. So Loma Linda, Pomona Valley, UC San Diego, UCLA. So even though we are a small hospital and a small group, we have connections with much larger facilities should you need any of those services. During the first trimester, we tend to see you about every 4 weeks. And then moving into the second trimester, It's also every 4 weeks. During those visits, you'll come in, you'll get your vital signs drawn. We have you leave a urine every time just to make sure that you don't have any infection and make sure there's, all the levels in your urine are appropriate. And then the big ultrasound after your very first one at 8 weeks comes at 20 weeks. And that's done in-house at our Northern Union Hospital radiology group. And so we would put that order in around 16 weeks, and then they would give you a call to schedule that. That's called your growth ultrasound, where they look at all the various parts of the baby, make sure growth is happening appropriately, and then also check the fluid levels of the baby. You can also find out the gender of the baby at that ultrasound if you haven't already with one of our specialized genetic blood tests that we offer. From there, there's a 24-week visit and then a 28-week visit. We do the glucose tolerance test to test for gestational diabetes. That happens between 26 and 28 weeks. And then also around 28 weeks, we do encourage every mom to get a Tdap, so a pertussis booster to protect their baby after delivery. Otherwise, we just love to see you, and we like having you come into the clinic so that we can check the baby, measure your belly, maybe occasionally do an ultrasound to check the position of the baby. And I think that's kind of the bulk of first and second trimesters at the clinic. We are located right next to the rural health clinic. So for those of you who have been to Northern Union Hospital, it's actually pretty much the same address. So 153B Pioneer Lane. And it's just a small little portable, but you would be surprised when you walk in how beautiful it is. We have lots of pictures and professional photographs of babies and moms that have delivered in the past. So, and then we do have multiple ultrasounds in the clinic, so we can always get imaging if we need to. So I think that's it. Welcome to our practice, and we look forward to seeing you.
Okay, I get to talk about third trimester prenatal care, and I just kind of want to reiterate and say, just like what Jenny said, our office is right next to the hospital. All the services are very conveniently located. When we see you in the third trimester, we see you starting at 28 weeks. We see you every 2 weeks after that. And then after 36 weeks, we see you weekly. The purpose of the third trimester is to just look closely for things that can develop in the third trimester. Sometimes those things can be elevated blood pressure. So we're checking your blood pressure every time you come in. Elevated blood pressure in pregnancy is sometimes associated with some changes in the urine. So we're checking your urine every time that you come in. You'll have an opportunity to speak to one of your providers. Like Jenny mentioned, 3 of our 6 exam rooms have ultrasounds in. Oftentimes during this part of pregnancy, we're checking to make sure that baby's already head down. So there's ultrasound available. We do one additional test at 36 weeks, and that's looking for group B strep. Group B strep is just a bacteria that's found normally in the intestines of some women, but babies just do not have a very good defense mechanism against it. So if you are GBS positive, we'll talk to you about using antibiotics during your labor, and we'll answer questions about the rationale behind that. But basically, it's just to keep those babies from having a GBS infection that can sometimes be very significant. In the third trimester, we're getting you ready for labor and delivery. We want to prepare you for the signs and symptoms of labor, reasons to come into the hospital, like if your water breaks, if you're feeling intense and regular contractions, or if you just need reassurance, you're not feeling the baby move, or if you're not sure that this is the true onset of labor. We talk a lot about breastfeeding and breastfeeding support, especially those moms who haven't breastfed before. We want to make sure that they're aware of the benefits of breastfeeding and how to establish breastfeeding and what resources will be available in the hospital and in the postpartum timeframe to really get the help that we all need when we're breastfeeding for the first time. We talk a little bit about pain medication options and options that are available to help, like movement, massage, that would come from your partner, not from us. Hot showers, warm packs, and then also some pain medication options that would be available if people wanted to use those. But we will support you in whatever you would like to utilize during that time frame. At this time, usually we'll encourage people to go over and before the COVID pandemic, we oftentimes would send people in for a tour of labor and delivery. I'll have Julie talk a little bit more about what is available in that aspect. But speaking of the COVID pandemic, I also just wanted to highlight how during that time and during this time, we really started to utilize a lot of telehealth and telephone health options. So especially for those patients who are ill, who are staying at home, for patients who have a long distance to drive to us, many of our clinic visits and our education visits can be done either over the phone or through telehealth. So if that is something that you're interested in, there's really about 4 or 5 prenatal visits that we want you in the office so that we can be doing part of an exam, an ultrasound, or something like that. But many times we do have the ability to switch an appointment over to telehealth if that improves the ability to make it to the visit. And I think that that is all I wanted to say about third trimester prenatal care. At this point, I am going to turn it over to Julie Tillemans, our Director of Perinatal Nursing.
Hi, everybody. Welcome. It's an honor to be here. Labor and delivery is such a special time in your life. So we are honored that you've chosen to be with us tonight to learn about our facility. So labor and delivery is located on the 2nd floor of the hospital. So depending on what hour you arrive to labor and delivery will determine if you can access our department through the emergency room or through the front lobby. Once you get up to the 2nd floor, we are a locked and secure unit. So you will see that you'll have to press a button to be able to access the microphone to say that you're here. And then once we open those doors for you, your journey begins. And so we are so excited. So you will walk into a very open, spacious labor and delivery unit where you'll see our whole entire nursing staff who will welcome you in. We have a centrally located monitor that we see at the nurses station that we can monitor mama and baby, but then depending on your presentation, we'll either put you into our triage room and assess why you're here. Are you here because your water broke, or are you here because you think that you're about ready to have your baby? So the triage room is the only room in our facility that is a shared room and has a shared bathroom. So based off of our determination of if you're ready to be admitted, we'll go ahead and we'll admit you to your own private labor and delivery suite. And it has everything that you need. So don't worry about packing your hospital bag, or if you haven't already packed it, you don't have to go home. Just come in, get reassurance that mama and baby are doing good, because we have everything that you need in our rooms for the first couple days. So you will walk in, you'll see your own labor and delivery bed. Each room has a designated infant warmer. It has a bassinet for your baby for safe sleep. You'll see monitoring equipment for mama and baby. And then typically whenever you walk into labor and delivery, it's pretty standard, just like the clinic. We're going to ask that we get your weight, see if you can leave us a urine specimen, and then we get mama's blood pressure, and then we go ahead and we check baby's well-being. And then from there, if your provider doesn't already know that you're here, we'll let them know. They are readily available to us. We're in constant communication. So even if they're in the clinic, we have wonderful communication with them. So we'll let them know you're here. We'll talk about, do you have a birth plan? What's your plan of care? And then we'll just talk about, like Dr. Arndal mentioned, what is your plan for pain management? We have both pharmacological and non-pharmacological options. So if you want to hop in the shower, if everything is looking good, you can totally do that. We have birthing balls. We have these things called a peanut ball to really help get baby in the right position. And then we also have nitrous oxide, which is an amazing thing. A lot of people don't know what nitrous oxide is, but it's laughing gas. And sometimes you get it when you get your wisdom teeth taken out. But we do offer that as well. And that is a really good option if you're just not quite sure that you're ready to move into the other alternative. So which could be an IV medication to help, or your epidural. So we talk about all of those things, and then it's your time just to labor, and we talk about what happens immediately after delivery. And so, sometimes it happens quick and sometimes it's a couple days. So we just are in constant communication with you. We really like to know who your support person is and involve them in the whole entire process. We're a community and we have a huge community feel. And so you guys are our family, and we are so honored to be able to take care of you guys. And then we hold a really prestigious designation, which is baby friendly. What does baby friendly mean? Well, we uphold the highest standard for infant feeding practices and to get you and your baby off to the best start in life. So I don't know if anybody else, Jen, if you're going to talk about kind of some standard practices, but we do delayed cord clamping immediately after your baby's born, immediate skin to skin to get a hold of your baby naked on your chest right after delivery. And that helps with an amazing, a numerous amount of things, including initiation of breastfeeding practices, helps regulate your baby's heart rate, their blood sugar, their temperature, their breathing. You get to learn your baby gets to learn you. So we like that to be about an hour or as long as you want it to be. And then we typically give some newborn medications immediately after delivery. And we have this discussion with you before it all happens, so that you're fully informed and we already know what you would like us to move forward with. And that time is really special for you and your family and your support and your baby, just to be there and to bond. And so you'll have your primary nurse there with you. Your physician may still be at the bedside with us as well. And then you'll have the nurse at the bedside that's taking care of your baby. So there will be at least 2 people in the room kind of for the first 2 hours after delivery with you, just really making sure that you and your baby are transitioning well. So after that 2-hour period, we also do rooming in, which just keeps that baby in your room so that you guys get off to the best start. And we help with breastfeeding or whatever your feeding plan is. We are here to help you. We have extra training in that. And then the rest of the hours are meant for you just to get some rest, for you and your support and your baby just to bond. And that is kind of the highlight of the labor and delivery phase. And there's so much more involved. So if you guys have questions, please put them in the chat. And we're here for Q&A after. But it's a privilege to be able to take care of you guys. And it's so, it's an honor. So thank you for letting us be there.
Okay, I think I'm up. I'm Jen Norris. I am a certified nurse midwife. I do normal vaginal deliveries. So if things are looking out of the realm of normal, I will call one of the OBGYNs to come in and co-manage or assist. But if you are planning on just having a normal natural delivery and everything is going well, then I will be there to help assist with getting your baby safely here. Another thing that I do is I'm a lactation consultant. So if you are having any problems with postpartum breastfeeding, which it's really hard, don't let people tell you it's super easy. It is really hard to get going. We are here in the clinic to support you. I will see patients in the clinic to do lactation counseling and lactation services. Sometimes the pediatric office will call and have me do a consult if they feel like the baby isn't gaining weight appropriately. So as far as the postpartum goes, like Julie said, we want that baby right on your chest after delivery. That's going to help with breastfeeding. And the best thing you can do is offer that baby the breast as much as the baby wants, or at least every 2 to 3 hours. That's going to help get the baby used to going to you to food, and it's going to also help stimulate your milk supply. Things such as flat nipples, sore nipples, baby not gaining weight appropriately, those are all things that a lactation consultant can help with. So That would be me, and the pediatric office has another lactation consultant, Lori Gable, who is also wonderful, who can help as well. There's also local resources. I know First Five in Mono County offers lactation services, and I believe First Five and WIC here in Inyo County offer those as well. I believe Toyabe also offers lactation services as well. Lactation is difficult. I just want to reiterate that. So don't feel like you're failing if you have to come in and get some help. We do like to see you after you have your baby at 2 weeks postpartum. That is to see that breastfeeding is going well, that you're adjusting well, and making sure that you're healing well from your delivery. We also like to see you at 6 weeks postpartum. That's where we will really talk about contraception, still ensure that breastfeeding is going well, and make sure that you're not getting into a postpartum depression or in postpartum depression that we can help you with. The 2 week visit is really important just to make sure that you are not staying in the baby blues, which is something that you can have just with hormonal changes that makes you just feel like you're crying all the time, which is a normal transition. You're tired, your breast probably hurt, lack of sleep, having to care for this new little human. It's a lot of stress, so that can take a toll. By the 2 week mark, you should be feeling better, and we just want to make sure that we're there to support you at the 2 week mark, because if you're not transitioning, then we have tools that we can use to help you come around. After the 6 week visit, it is usually you just transition right into well woman care, though really postpartum is a year after you have the baby. So if you're having any problems after that 6 week visit, we also encourage you to come in and see us. If you're having lactation issues, you're having depression issues, if your periods are acting strange after delivery, come in and see us. That's what we're here for, is to support you and to answer your questions.
And one thing I wanted to mention, which I believe I forgot, is we do offer childbirth education classes, and they're taught by 2 of our labor and delivery nurses. And so one of whom actually works in the clinic. So you would have a chance to meet her before actually attending one of the classes. They're 4 hours long, and they are either via Zoom or actually in person. You can choose your modality, and they're really informative, especially for first-time parents. And we've gotten a lot of really good feedback.
And they're free.
Yeah,
and
and
they're in English and Spanish.
Thank you.
And I forgot to touch on, well, the baby's doctor. The baby's doctor will come and visit you guys in your room shortly after delivery, and then every day that you're here before you go home. And then once you go home, kind of depending on where's baby at with the weight and how's feeding going and what's, we base it off of a few other things. Then we say you can either follow up with our Bishop Pediatric or wherever pediatrics is closer to you within 24 to 48 hours. So 1 to 2 days, you'll follow up closely with your pediatrician as well. So forgot to mention that. And I feel like, what about a C-section? What if you're a repeat C-section and curious about our hospital? Dr. Arndal, would you touch on that a little bit?
Yeah, I was going to say, we take care of patients throughout their pregnancy, but occasionally babies are either scheduled to be delivered by C-section. This could be a mom who's had a previous C-section or a baby that is not in the right position for delivery. And so in those situations, we would schedule a C-section at 39 weeks or about a week before your due date. These moms come into our labor and delivery unit. We initially see them and evaluate them and their babies, and then we take them downstairs to our beautiful, spacious, brightly lit OR, Our OR experience is designed to be as family friendly as possible as well. You will have one support person in the operating room with you. They will be located up by your head so you can hold hands, and so they can help with snuggling and bonding with that baby. Our goal is to get that baby directly onto your chest as soon as possible. So usually after the baby's cord is cut, there'll be an initial evaluation by our labor and delivery staff to make sure that the baby is breathing and has good heartbeat, all of those things. And once we check that out, then like I said, the best warmer for that baby is you. And so that baby will come right onto your bare skin of your chest here. And then you guys just get to snuggle as we finish the rest of the procedure. We do have a lot of things in place to make your recovery after C-section as successful and rapid as possible. So we're always doing things, simple things like offering chewing gum after your C-section can help your bowels to start up again. We're making sure that we do everything so that there isn't any interruption of bonding and breastfeeding there as well. So those are some things with, and in unscheduled C-sections, whereas somebody might be in labor and then there's a reason that presents itself for need for C-section. It's a very similar experience. In all except for the most emergent situations, we still have a family member in the room or a support person in the room with us, and we still do all of those things with initiating bonding right away. And then there are some high-risk pregnancies that we either during the pregnancy, like Jenny was talking about, coordinate care with other larger tertiary care centers outside of our community. And sometimes these higher risk conditions present themselves more as an urgent or emergent nature. And those patients, we go ahead and get them all packaged up and we'll deliver them by airplane to a facility in a larger community. And they are delivered there, but then these patients come home and continue to get all of their post-op or postpartum care with us in the office here. And then I think that although we're talking primarily about perinatal services, obstetrical services, we really just want to express the importance of health and well-being for women in general. If you have any obstetrical questions, if you have any questions about getting pregnant or the inability to get pregnant, if you guys have any questions about, additional postpartum resources or just general health in between your pregnancies, we want to be available for all of those needs as well. So we encourage you, if you are pregnant, if you are thinking about becoming pregnant, if you have a loved one, if you have questions or concerns, we would encourage you to come in and meet us, see our office, see our beautiful labor and delivery facilities, and we'd love to continue that conversation there. And I think we're opening up at this point to any questions. So if anybody has any questions, you can put that into the chat screen and we will get those answered for you.
Okay, Dr. Arndal, there is one question in the YouTube chat. It says, if I have a birth plan, what contingency should I include in it?
Yeah, I think that birth plans are really helpful in the sense where everything is online. So if anybody is interested in making a birth plan, you can just literally Google birth plan. Also, birth plans can somewhat be developed during these prenatal classes that we have. I think that your labor and delivery journey is going to be different than everybody else's you're talking to, your specific desires, things that you would like to use or things that you'd like to avoid. It's good to just kind of have that process and thought out before you come into labor and delivery. There will be some things that are offered to you. Having a little bit of information and a little bit of clarity about how you feel about that option is good. Having said that, we're all on the same journey together, and we will continue to talk about your options and resources that are available. We will answer your questions at that time. It's not uncommon that people, their mom had babies in, 4 hours, but they come in and they have the 24-hour labor, and it may change what you think that you would like to try at that point. So birth plans are a great way to just investigate different options, to kind of have your preferences known. And then as you go through the labor experience, we will continue to refer back to that, but we will continue to just be flexible and offer you different resources if you need those.
I'd like to go on that. We offer pre-hospital, pre-admission tours as well. So in the 3rd trimester, you can call Labor and Delivery, and we can get you scheduled for an appointment, where you can walk through the unit, see the rooms, and we can talk about your plan. And we also have a sheet that you fill out that just emphasizes what your plan would be. And then we can have that discussion as well. So that's a really important thing and a service that we offer. So I would encourage anybody in their 3rd trimester to either bring it up at your prenatal appointment or call us directly. It's free. It can take as short as 10 minutes or as long as an hour. So we are here to answer any of your questions and take away any of those unknown anxieties that you may have.
Perfect. Thank you, Julie. That was another question that someone had asked. There is a follow-up to that too on something that you had mentioned. It said, Julie had mentioned, and I'm going to probably say this wrong, nitrous oxide. What other pain relief options are available to me?
Jen, you wanna?
So besides nitrous oxide, you can have some IV pain medication. Typically what we give is fentanyl. I know it's a little scary in the news about fentanyl lately, but given in a obstetrical sense, it is safe and it is effective. And then there are people who choose to have an epidural, which is a great tool. The anesthesiologist comes in, does the procedure, it goes in your back, and you are essentially numbed from the belly button down and can make birth very comfortable. You won't feel the contractions, or you won't feel them as much. Sometimes it's used as a relaxation tool. It's not always used just for pain relief. Some women can handle the pain, but they have a hard time relaxing. Sometimes just getting an epidural can help you relax and can sometimes make things go a little bit faster.
And can I say something? My name is Annika Bishop. I'm a registered nurse here at NIHD, and I have worked here for 16 years already. So we see a lot of patients who come in with a plan like, I don't want to have any pain medication. I want to do it as natural as possible. Or we have patients coming in who go like, I want an epidural as soon as I know as I'm in labor, I want an epidural. And you're going to see us most at the labor and delivery staff. You're going to see us more than Dr. Arndal or Jen or any of the other physicians. We walk in your room constantly and we ask constantly, how are you handling it? Are there any changes in the plan that you would like to do right now? And we listen to you. I mean, it's not like if you're having your birth plan, I absolutely do not want any fentanyl. We're not going to push fentanyl on you if you don't want fentanyl. Or if you say like in your birth plan, I want to do it as natural as possible, and you change your mind like halfway. You know, we discussed the options for pain medication, and we also might suggest we might have some suggestions at some point. So we are open to anything. You are the patient, you and your partner are the most important people at that point, and we listen to you. If you have any questions, we will call the doctor. But you will see a lot of us, so please tell us your needs, and we will see, you know, if we can do it without any problems or that we need to discuss anything with one of the providers. So that's what I would like to add on.
Thank you, Annika. There is one more question in the chat. It comes from Karen Roberts. She says, I am a birth doula, recently relocated to the Owens Valley. Are doulas allowed?
Yes, absolutely allowed. You
Yeah,
guys are
allowed and allowed and encouraged. Yeah.
absolutely.
We were going to be very busy.
Yeah.
Yeah, we work really, in conjunction with you for the patient. So you're part of the team.
If anybody has any questions about what a doula is, when I was in medical school, I actually went through the process of doula training. It's basically just somebody whose sole focus is there to support you and to give you options for helping with pain, helping with movement or strategies that might help you tolerate your labor or speed up your labor. It's really just somebody, everybody has a focus here, your provider, your nurse, your doula's specific focus is on how you're tolerating labor and if there's anything that they can offer or recommend. They're in the room with you, which is not something that we can all do continuously, but they are in the room continuously. You are their one person that they are focused on. And sometimes that can make all the difference. If you, like Jen was talking about, can't relax, sometimes babies can have a hard time coming through that birth canal. So we want to try different relaxation strategies, different movement strategies to kind of help that baby navigate through the birth canal more successfully.
Thank you. Any additional questions from the audience? Checking out both the chats. I believe we are caught up. Thank you so much for sharing your information with the group tonight, and we look forward to seeing you again in the future.
Thank you, guys.